One of our main hormones that keeps us sharp and strong and helps us feel like ourselves is so overlooked by most prescribers that they only think to prescribe it for one single condition. But it does way more than one thing, and you don't want to miss out on its benefits. You're listening to the Health Courage Collective podcast, episode 228, The Missing Note in Midlife's Symphony, Testosterone. Welcome to the Health Courage Collective podcast, the show for women who are too busy to slog through hours of generalized, inapplicable, and often contradictory health information, but too smart to ignore that a few minutes of focused attention now can prevent years of suffering in the future. I'm your host, Christina Hackett, a pharmacist who doesn't want you to live on prescriptions, a certified coach specifically trained to maximize your potential, and a compulsive learner obsessed with preventative, cutting-edge, holistic, and integrative medicine. I'm on a mission to increase your physical and mental resilience so you can fearlessly look forward to your next 40-plus limitless years. Your time is now. Let's go. Hello, my friend, and welcome to the podcast. I hope you've had a great week. How is your not wanting to know going? Data is neutral, and avoiding it because you're making it mean something that it doesn't really mean, like a moral judgment about you, keeps you from getting everything that you want. When you think about midlife hormone changes or hormone replacement therapy from perimenopause and menopause, what hormones do you think about replacing? Yeah, most women, actually most people, think about estrogen. If they're really advanced, they might think about both estrogen and progesterone. How come? I don't really know, but I do believe that we have a tendency to try to simplify everything. And for most men, if they're suffering from hormone decline and you replace their primary hormone, testosterone, that fixes the problem. So we likewise think if we replace a woman's primary hormone, estrogen, that'll fix the problem. And progesterone is only good for preventing uterine cancer if you still have a uterus and take estrogen. That's wrong, by the way. But women are not like men. Shocker, I know. And if you're getting technical about it, our primary sex hormone is also testosterone, inasmuch as we have more total testosterone circulating around our bodies than we do estrogen. Really. Men also produce estrogen and progesterone, so we both use all of the sex hormones. But women's hormonal orchestration is much more complex. For the most part, men gradually produce less testosterone slowly over time, and eventually replacing it is usually all they need. But for us, for 35 years, we've had different levels of estrogen, progesterone, and testosterone every single day of the month. And they all work together, so our bodies are capable of some next level, crazy, amazing stuff. When we're optimally healthy, there's an elaborate hormonal interplay going on. Then at menopause, those hormone levels fall off a cliff, usually with some crazy ups and downs first during perimenopause. Treating women like men by replacing one hormone at a standardized dose is not adequate or fair. We've got a lot more going on, and we deserve better. Estrogen isn't the only hormone that helps us feel like ourselves. It's vitally important, but it's not independent. Dr. Rachel Rubin says that in her practice, she'll often see women who have had some success with hormone replacement therapy, meaning estrogen plus or minus progesterone, and then she adds testosterone to the mix, and that's when they come alive and tell her, I finally feel like me again, or this was the missing piece, or I didn't realize how bad I felt before. I didn't know it was possible to feel this good again. Testosterone is powerful, and it shouldn't be ignored. So most of our testosterone is produced in our ovaries and our adrenal glands. It's more complicated than that, with production of pre-androgens like DHEA being sent out and being converted to testosterone peripherally, but we'll just go with our ovaries and adrenal glands being the main producers because they are. Unlike estrogen and progesterone, our levels actually stay pretty level throughout the month. There's a slight bump in testosterone around ovulation time, like from days 12 to 16 of the cycle. You typically have a little bit more testosterone, and your testosterone level is just slightly higher in the second half of your cycle than the first. But overall, not big changes throughout the month like there are with estrogen and progesterone. Some of the things testosterone does for women are to keep the brain healthy and sharp, decrease chance of depression, maintain or build muscle mass, help with bone strength, prevent UTIs and pain with sex, increase libido, reduce risk of breast cancer, increase energy, increase assertiveness, prevent sagging skin, and help with immune system function. I'm sure there are many more. We all need our Goldilocks level of testosterone. Not too much, not too little, to feel like ourselves. Some women have too much testosterone. Some just have too much relative to their estrogen level, even though it's not necessarily high. And some women have too low of a testosterone level. So it's not something that you just replace blindly or say, every woman needs to take this. But every woman does need the right amount of testosterone to feel good. I always thought testosterone decline in women was due to menopause. It made sense to me that as your ovaries stop producing other hormones, they stop producing testosterone too. And I do know that surgical menopause, meaning removal of the ovaries, creates a much more abrupt decrease in testosterone than natural menopause does. But according to urologist Dr. Rachel Rubin, testosterone loss in women is more age-related rather than menopause-related. Our testosterone production decreases over time, starting in our 30s, just as a result of getting older. Interesting. There aren't very many things that doctors all agree on, especially related to women's hormones. One of them is that testosterone for women will improve low libido. Testosterone cream, usually applied vaginally or to the clitoris, improves libido, desire, and pleasure. It's a fact. But most providers think that that's the only reason to use testosterone in women and the only benefit it will provide. And most of them are wrong. In addition to the sexual benefits, which are true, testosterone does all the things we talked about earlier. Preventing UTIs and urinary incontinence, brain health, mood, anxiety reduction, muscle mass improvement, bone strength, fat reduction, decreased aches and pains, more energy, an increased sense of well-being and self-esteem. For this reason, I've heard some cavalier hormone clinics, like the kind that push hormone therapy a little too hard, who put women on tons of testosterone, like close to male levels of testosterone, because the women feel great. They have a ton of confidence and energy and the highest sex drive they've ever had in their life, and everything feels really good. Meanwhile, their voices drop 2 octaves and they have facial hair acne and clitoral enlargement. I suppose if that's your goal, I'm not the one here to tell you that you're wrong about that, but it would not be my goal. The way I see it, we're trying to help all of our cells and organelles thrive on their own by giving them the ingredients they need to be able to survive and thrive for another 40 or 50 years, including the levels of hormones they had when we were in our 30s, before age-related processes started gumming up the works. I also don't want a deep voice or facial hair. Not because that's wrong, but because it doesn't feel like me. I think the best way to tell whether you need testosterone replacement therapy is to get tested and find out. A testosterone blood test is an available and good option. Testosterone is also something you can test for in a Dutch complete hormone urine test. You can also do both. That's what I did, and the levels correlated perfectly, which made me feel pretty confident in their accuracy. There is a little bit of weirdness involved with sex hormone binding globulin and free versus bound testosterone and how that reads in a blood test. The testing is important, but we don't treat lab levels, we treat women, so it's good to know the signs of low testosterone. If you don't have any of them, you might consider skipping or delaying testosterone replacement therapy, at least for now. Some signs of low testosterone in women include anxiety, low muscle mass, low HDL cholesterol, low libido, droopy eyelids, thin skin, saggy cheeks, thin lips, drying, thinning hair, fatigue, being hyper-emotional, not having any dreams, loss of pubic hair, low self-esteem, depression, fat gain, pain with sex or other pelvic pain, frequent urinary tract infections, and urinary incontinence. On the other hand, some signs of high testosterone include acne, clitoral enlargement, deepening voice, facial hair, agitation, anger, scalp hair loss, infertility, irregular periods, mood swings, hypoglycemia, insulin resistance, salt and sugar cravings, and weight gain. The side effects of testosterone treatment are just the signs that your dose is too high. So any of those signs of high testosterone would be the side effects, and then you would need to cut back on your dose. More women don't start testosterone therapy because they're worried about the side effects than start it and stop it because of the side effects. If your levels show that you're a good candidate for treatment, you're most likely to be very happy if you give it a try, knowing that you can decrease the dose if you have any of those side effects of high testosterone. Just a quick note that the genitourinary tract is full of hormone receptors and is very hormone sensitive. We talked about this recently in just episode 213. Every woman should be on this prescription. Vaginal tissue, but also your bladder and urethra and the vulvar vestibule that surrounds it. Estrogen receptors, but also testosterone receptors are there. This is why an inexpensive estrogen and or testosterone and or DHEA treatment is so effective for treating genitourinary problems and preventing them. Vaginal dryness and atrophy, urinary incontinence, urinary tract infections, interstitial cystitis pain, pelvic pain, pain with sex. And my opinion is that since we have both estrogen and androgen, such as testosterone, receptors there that start crying out for hormones in the form of genitourinary symptoms, estrogen helps and is good, but both estrogen and testosterone together is ideal. In episode 213, we also talked about vaginal DHEA. The idea with that is that it's kind of a pro-hormone that can be converted to both estrogen and testosterone, so you're satisfying both of those needs with DHEA, kind of. If you do have a lot of problems with pelvic or genitourinary pain of some kind, I'd recommend you check out urologist Rachel Rubin. She talks a lot about the importance of the vulvar vestibule and how overlooked it often is as a source of pain and an area that often responds miraculously to hormone therapy. It's the area inside the labia minora around the urethra. Apparently, it's made of endoderm tissue or skin that is distinctly different than the ectoderm and mesoderm tissues on either side of it. And that's almost always overlooked to women's detriment. It's super hormone sensitive and responds well to treatment, easily erasing persistent pain for many women. What I'm trying to convince you of today is that if you choose to replace your natural human hormones once your hormone levels start to decline in your 40s, that doesn't mean just estrogen. When your ovaries start transitioning toward retirement, the effects you feel aren't just from lack of estrogen. A lot of it is, but a good portion of it could be due to testosterone decline. And the real truth is that it's about the balance and interplay of all of your hormones, including cortisol and melatonin and insulin and everything. And the ratios of estrogen to progesterone to testosterone. Testosterone plays a huge role in your overall resilience and ability to prevent or drastically delay all of the common diseases of aging. It can be tricky to find a provider willing and competent enough to work with you to get your estrogen and progesterone where you want them. Potentially adding testosterone optimization as an equally important priority could make that even harder. Maybe not though, and it's so worth it. There's a big bias among providers to think of testosterone only as treatment for low libido. I hope I've convinced you that that's much more than that. If your goal is to provide your cells and organs with the ingredients they need to function optimally so that you can stay resilient and opt out of the common chronic diseases of aging like decreased muscle mass, decreased bone strength, dementia, forgetfulness, increased risk of cancer, cardiovascular disease, and the metabolic dysfunction that drives all of those problems and more, comprehensive hormone replacement therapy is probably the biggest tool you have. That's a hard one. You could make a case that exercise is your highest leverage mechanism. Hormones are a big deal, and they play a lot of roles. But most people and prescribers don't see them that way. They think of the only reason to take hormones is to alleviate symptoms of menopause. So it makes sense that they would just prescribe estrogen at the lowest possible standardized dose that's the same as everyone else gets for that, and progesterone if you have a uterus to protect. There's no level they're trying to reach. They don't care about the amount of different hormones in relation to one another. So they're not testing anything. And testosterone isn't something you want to just blindly replace. You want to get tested and know your level because it's possible that your testosterone to estrogen ratio is too high. You've got to be in the proper balance in order to feel like you. Replacing testosterone in women with low estrogen seems to increase risk of heart disease, obesity, diabetes, and scalp hair loss. Testing can be via blood test, dried urine test, or saliva test. Preferably 2 of those if possible, like a Dutch complete dried urine test plus a blood level if they're also checking you for other blood level stuff. Something else important to know that I only recently learned is that you don't want to start replacing your testosterone when you start replacing your estrogen for the first time, as if there aren't enough obstacles to getting everything started and running smoothly. But it's better to start with your estrogen and progesterone first and then add testosterone after a few months. Because when your estrogen has been low for a while, you kind of have to gently wake your estrogen receptors back up again. And sending testosterone around your body can hijack some of those estrogen receptors. I'm not totally sure how that works, but once your estrogen is back up to the level you want it to be and your receptors are no longer down-regulated, adding testosterone doesn't mess things up anymore. And if all that weren't complicated enough, once you convince your prescriber that testosterone is important, you get your levels tested and you start your estrogen first. When it comes time to actually get a prescription for testosterone, there are no testosterone products for women, except for in Australia, apparently. Everywhere else, you are stuck trying to figure out how to use a tiny portion of a prescription made for men or getting a compounded version custom made for you by a compounding pharmacy. There are plenty of doctors and medical people who don't like the idea of using compounded prescriptions because they're not regulated in the same way that commercially available prescription drugs are. And there have unfortunately been some bad compounding pharmacies that have done some massively stupid things. So I can get the hesitation. But as a pharmacist at a compounding pharmacy, I can tell you that we care very deeply about precision and accuracy and quality, way more than most drug manufacturing plants, most of which are in India and do everything they can to get away with cutting corners. It's sad and scary and true. So while you'd have to be really sure you were using a good compounding pharmacy, I totally think that's the way to go. There are so many advantages. You can get a dose made just for you. You can decide what vehicle it's in, like what kind of cream, what inactive ingredients are in there, and how you measure it. Pump, clicker, syringe, whatever. You can combine multiple ingredients into one dose if that makes sense for how you're doing your dosing. Basically, you can get it made however you want, and you're not stuck with any kind of standard dose. The disadvantages would be that the chance of your insurance paying for it would be approaching 0, but they wouldn't pay for commercially available men's testosterone for a woman most likely either, but maybe. And the commercial stuff is way more expensive. This is true no matter which testosterone you get, compounded or not, but it's a controlled substance, like Valium or Klonopin. Even at a dose of 0.25 milligrams, which would do absolutely nothing for a roid user who's on juice, or whatever gym meatheads say. In Utah, the only controlled substance a naturopath can prescribe is topical testosterone. I'm definitely in favor of them being able to prescribe it. It might be different in your state. Some prescribers may not be allowed to prescribe testosterone. And like other Schedule 3 through 5 drugs, a prescription would only be valid for 6 months from when your doctor issues the prescription, unlike estrogen and progesterone, which are good for 1 year. You'll want to apply your testosterone cream once a day, usually in the morning, to a hairless area of thin-ish skin. It's possible that it can increase your hair growth in the area that you apply it, so keep that in mind. Usually, like your inner thigh is a good place to put it. There's a chance you might have to increase your hair removal efforts in that area. Or applying it vaginally or to the vulvar vestibule is also a good option. It will help with libido, pleasure, vaginal moisture and thickness, and general health. It will reduce risks of UTI and urinary incontinence, and is especially helpful if you have any pelvic pain like interstitial cystitis or pain with sex or anything. Whew. That was a lot longer of me blathering on about testosterone than I expected. What do you think? My goal was to convince you that if hormones are part of your strategy to age at an elite level, you need to consider testosterone, not just estrogen. I also have a great love of progesterone, and I think it's way more important than most people give it credit for. We've talked about it in previous episodes. Testosterone levels decline in both women and men as we get older. Testosterone is critically important for overall physiologic resilience, which is the very thing you need to be able to age at an elite level. Halle Berry and Kate Winslet use it to feel like themselves again, if that carries any weight in your decision-making process, which I'm not sure that it should, but they're fabulous, so maybe it should. I mean, Kate Winslet was on Running Wild with Bear Grylls, and a person can't possibly get much cooler than that, in my opinion. Testosterone helps keep your brain healthy and sharp, decreases your chance of depression, maintains strong muscles and bones, improves vaginal and urinary health, increases libido, increases energy, increases assertiveness, prevents sagging skin, and boosts your immune system. There are obstacles to being able to use it, but I think the reward is worth the hassle. So as you're coming up with your personal plan of what you want to do with your hormone levels as you get older, don't forget about testosterone. If you need help coming up with an intelligent plan of what you want to personally do with your hormones and how to make that plan happen and find a prescriber and a pharmacy to work with and what to expect in terms of cost and all of that, get on the waitlist for my beta program and help me design a program that will guide women through these decisions and steps as I help you get on track for the elite level of care that you deserve. Click on the link in the show notes or go to my website, healthcouragecollective.com, and get on that waitlist. It's going to be awesome. Thank you so much for being here and caring about maintaining your energy and strength as you age. Next week, we're going to talk about a more enjoyable process you can use to make positive changes. It's called appreciative inquiry. Until then, remember the power of testosterone for women and don't be normal. Thank you so much for tuning into the Health Courage Collective podcast. I am truly honored that you have paid me the enormous compliment of your time and attention. I would be so grateful if you would share this podcast with someone you know and subscribe so you never miss an episode. This podcast is for entertainment and information purposes only. Statements and views on this podcast are not medical advice. This podcast, including Christina Hackett and producers, disclaim responsibility for any possible adverse events by use of information contained herein. If you think you have a medical problem, consult a licensed physician.